Hello everyone. This is Jenny from Let's Speak by Insight OET. I'm here with an OET speaking roleplay for nurses. So watch the video completely. Here's the roleplay card. You have 3 minutes for preparation. After that, you can do the roleplay with us. At the end of the video, you can get our version of the full conversation. So start preparing. Your preparation time is over. Now let's speak. We'll play the interlocutor's part of the conversation. And you can add the nurse's part accordingly. Don't worry if you can't catch up or manage time. You'll be able to do that with practice. And at the end of this video, we'll provide you a full version of this conversation. So, let's speak.
Good morning. Okay. All right. Okay. Actually, my knee still feels a bit painful, and it also looks very swollen. Although I feel a bit tired, I am looking forward to going home. That's fine. Yes, nurse, it's okay. Yes. Yes. Sure, I will follow your suggestion. Sure. You may proceed. Yes. All right. I will keep these instructions in mind. Okay. I will make sure to look after the wound and I will look out for any signs of infection. No. Yes. My sister is coming to drive me back home. Well, nurse, I live on my own, so I will be able to manage myself at home and with the shopping. So I don't need anyone to stay with me. Yes. I understand the importance of having support. I think it's a good idea for my sister to stay with me. I will talk to her about it. No. Yes. Sure. Thank you, nurse.
I hope you performed well. So now listen to the full conversation.
As per the question, the patient is admitted to the hospital ward and is due for discharge soon, following a knee surgery. So it's a known case, and since the name is given as John Connor, we have to use that name to address the patient. And can call the patient Mr. Connor or simply John. So listen to the conversation.
Good morning.
Good morning.
My name is Claire, one of the registered nurses working in this hospital ward, and I'm your attending nurse here.
Okay.
Well, today I have a glad news for you. The doctor has confirmed that you are ready for the discharge.
All right.
And I am here to discuss some information on your recovery and wound care after the discharge. Is that okay for you, John?
Okay.
Thank you, John. Anyway, I would like to know how you feel now. So tell me, John, are you experiencing any pain or discomfort?
Actually, my knee still feels a bit painful, and it also looks very swollen. Although I feel a bit tired, I am looking forward to going home.
I'm sorry to hear that you still feel pain and tired. However, I can confirm that these are the usual side effects of the surgery. As part of the surgery, you have been provided anesthesia. And this will have some after effects. Some of the common after effects of anesthesia are tiredness, which you are currently experiencing, and lightheadedness. Anyway, nothing to be alarmed about it. Your condition will improve in 48 hours. How does that sound to you, John?
That's fine.
That's good, John. Along with this, you can also expect some other symptoms related to the knee surgery, such as pain and swelling on the knee. But try not to worry. I can assure you that it will gradually reduce, but the duration may vary from 1 to 2 weeks. Did you get me?
Yes, nurse.
By the way, there are some ways to manage pain and swelling. May I explain you that?
Okay.
One of the methods is to keep your leg in an elevated position, as this will help you to reduce swelling. Next is the application of a cold compress, as it will reduce pain and make you feel much better. And along with these methods, try to take painkillers as needed. Are you able to understand me?
Yes.
So, I suggest you to follow these measures to get rid of the after effects.
Sure, I will follow your suggestion.
Thank you for accepting my suggestions. Well, moving further, I would like to provide some advice to you on wound care. Are you willing to listen to that?
Sure. You may proceed.
Thank you. So the first and foremost thing is to keep the dressing dry and well covered. In addition, it's very important to replace the dressing if it gets wet or falls off. And John, always remember to redress the wound after every 5 days. Are you following me?
Yes.
These steps will ensure better healing and make sure there's no infection. Anyway, John, keep in your mind that your stitches are dissolvable. This means it does not need to be removed, whereas it will get dissolved naturally.
All right. I will keep these instructions in mind.
Anyhow, always be careful and keep an eye on the wound site. If you notice any unusual sign like pain, redness at the wound site, or if you feel any high temperature, please do not take it lightly. And I strongly recommend you to check these signs and seek medical attention at the earliest. Because these signs may indicate an infection at the surgical area. Am I making myself clear, John?
Yes. I will make sure to look after the wound and I will look out for any signs of infection.
That's good. So, do you have any queries, John?
No.
All right, now I would like to know whether you have anyone to accompany you during the discharge process. Is there someone like that?
Yes. My sister is coming to drive me back home.
That's really great, John. So what about your assistance at home? Because you may need some assistance at home for practical tasks like household chores or shopping during the first 24 hours after the discharge.
Well, nurse, I live on my own, so I will be able to manage myself at home and with the shopping. So I don't need anyone to stay with me.
Being independent is good, and I really appreciate that. But John, since you have undergone surgery, and as it is directly linked to your mobility, it is essential to have support after the discharge, at least for the first 24 hours. And it's very vital to restrict your mobility and weight bearing for a safer and speedy recovery. Am I clear to you?
Yes. I understand the importance of having support. I think it's a good idea for my sister to stay with me. I will talk to her about it.
That would be a good idea, John. So do you have any concerns to be addressed?
No.
Okay. So I hope you have got an idea regarding the post-discharge and wound care.
Yes.
If you have any further questions, always feel free to inform me.
Sure.
I wish you a faster recovery, John.
Thank you, nurse.
Thank you for listening to me patiently.
I hope you understood the roleplay. Subscribe to Let's Speak by Insight OET for more OET speaking content. Thank you for watching.